Now, what are the things which you should know when you are studying cardiac output, right? और what are the must known competencies कि ये आपको आना ही चाहिए cardiac output के लिए. You should know the definition of cardiac output, stroke volume, end diastolic volume, end systolic volume, ejection fraction. You should know what is cardiac reserve, what is cardiac index. These itself, they form a 2 marks BAQ. Just definition of cardiac output, normal volume of cardiac output, right? Then factors affecting cardiac output, this can come as a short note. Regulation, it can come as an LAQ also, right? So let's get started with with the session, and if there's any difficulty throughout, you can just let me know about it. Now, how do you define this cardiac output? This is very important because many times I have seen that when you are asked the definition of cardiac output, you are confused between what is cardiac output and what is stroke volume. You are very many times confused, per minute hai ki per beat hai, you are always confused with this. So cardiac output, basically, if you want to define cardiac output, it is the amount of blood, okay, it is the amount of blood that is ejected, by each or by the ventricle per minute. Okay, so it is per minute, it is not per beat. Stroke volume is the same definition but per beat, and this is the volume of the blood that is ejected by the ventricle or by each of the ventricles per minute. You can give it by a formula that cardiac output is equal to stroke volume into heart rate. So this comes as an MCQ to you, okay, and NEET PG mein you will find that this is a part of an calculation based MCQ. So cardiac output is equal to stroke volume and heart rate. What is the normal value of cardiac output? It is 5 to 6 liters per minute. Okay, so it is 5 to 6 liters per minute. So this is cardiac output ka definition. Now, what is the definition of stroke volume? What is stroke volume? So it is defined as the volume of blood. Okay, it is defined as the volume of blood that is ejected by each ventricle per beat. Okay, it is ejected by each ventricle per beat. ये सबसे important है कि per beat है और ये per minute, and इसका value होता है around 70 to 80 ml. देखो, this is ml and that was liters. Okay, so there is a difference between whatever you say, okay, ml and ml, and that was liters per minute. ठीक है, so this is stroke volume. Now next, what you should know or what definition you should know is something very important, a very important 2 marks BAQ, which you call as cardiac index. Now what is this cardiac index? So you will see that each and every person, whether it is, okay, there could be an 18-year boy, there are 4 to 5 18-year boys, ठीक है, so all of them are boys, so same sex, all of them got same age, but still you will see that the cardiac output will not be same in each of the person. It varies with your basal metabolic rate, it varies with your body surface area, it varies with your metabolism. There are lots of factors on which it is affected by. So you get a better idea by something which is called as a cardiac index, right? So cardiac index will give you a better idea than your cardiac output. So cardiac index is cardiac output, okay, it is cardiac output per square meter body surface area, per square meter body surface area. So when you are taking the cardiac output and you are also considering the body surface area, it becomes cardiac index. How do you obtain this? It is nothing but it is cardiac output at rest. Cardiac output at rest divided by body surface area, which will be in meters square. Okay, so this comes around 5 liters divided by 1.7. So the normal value comes about 3 liters per minute per meter square body surface area, and this thing is very very important. That means the unit is very important. You know, there was a quiz which was conducted, and quiz mein this came as a calculation based question, and the boy made the correct calculation, but he still lost the match because the unit which he gave was wrong. So this is liter per minute per meter square, because you are considering the body surface area. So it is standardizing your cardiac output even if the body sizes vary. So there is same age and there is same sex, but the size, body size varies. So you know, you can just rule out this component when you take the cardiac index. So it is preferred as compared to this. Now what happens that with age there is decrease in the muscle mass also, है ना? So this cardiac index will decrease with old age, and in old age the value will be around 2.4 liters per minute per meter square body surface area. Okay, so we've done with stroke volume, cardiac output, cardiac index. ठीक है. Now the very important definition is what is end diastolic volume. If you remember, we had already, you know, I had already uttered this word yesterday. But फिर से let us consider what is what is end diastolic volume. So as the name suggests, end of diastole. So it is the volume of blood. It is the volume of blood remaining or present in the ventricles, volume of blood present in the ventricles at the end of diastole. इसका मतलब जब ventricles का filling हो जाता है, right? जब ventricle का filling हो जाता है, उस filling के बाद में जितना blood रह जाएगा, that will be the end diastolic volume. So the volume of blood remaining in the ventricles at the end of diastole is end diastolic volume, and this is around 120 ml to 130 ml. This is the normal value of the end diastolic volume. What is end systolic volume? It is the volume of blood, okay, which is remaining or that remains in the ventricles after systole. After systole, that means आइसोवॉल्यूमेट्रिक contraction के बाद क्या हुआ? ejection. So ejection के बाद जितना थोड़ा सा blood volume will be remaining, and that blood volume is just around 50 ml. So this comes your end diastolic volume, end systolic volume. Now the next important thing is what is stroke volume. We have seen you can calculate stroke volume as end diastolic volume minus end systolic volume. So suppose this is 120 minus 50, so your stroke volume will come to 70 ml. Again a very important calculation based question or calculation based MCQ to you. Now let's move on to another interesting thing which we called as cardiac or the ejection fraction. What is ejection fraction, right? What is ejection fraction? Now this word ejection fraction is very very important because it is actually telling you about what fraction of the end diastolic volume is given to the body. So when we speak of ejection fraction, we are usually considering the left ventricle. Why left ventricle? Because it is the left ventricle which is giving the blood to the periphery, okay, which is giving the blood to the body. So this ejection fraction is nothing, it is stroke volume divided by end diastolic volume into 100. So we know how to calculate stroke volume with the given end diastolic volume, and the normal value, it comes between 60 to 65%. So if there is a, you know, this it is a very good indicator or a very good index of the myocardial performance. It is a very good index of the myocardial performance, and if there is a decrease in the left ventricular ejection fraction, it is indicative of a decrease in the cardiac output or a poor functioning of the ventricles. Okay? Now the next very important thing, again a very important 2-mark BAQ, which we called as cardiac reserve. What is this cardiac reserve? What is this cardiac reserve? Okay, so cardiac index, where you standardized the value of the cardiac output in terms of body weight, in terms of the body surface area. Now यहाँ पर cardiac reserve का जो definition होता है, it is the amount of blood volume which can be pumped by each ventricle in excess of cardiac output. What is the normal cardiac output? 5 to 6 liters per minute. But suppose if the person is performing exercise, definitely what will happen to his cardiac output, it will increase. So that is telling you about how much reserve a person has, or how much maximally the person can increase its cardiac output above normal. So it is the amount of blood volume, it is the amount of blood volume that can be pumped by each ventricle, in excess of cardiac output. मतलब नॉर्मल कार्डियक आउटपुट से बहुत ज्यादा it can be pumped by each ventricle, and you will be surprised to know that इसकी वैल्यू हो सकती है around 15 to 25 liters per minute. I repeat, 15 to 25 liters per minute in non-athletes. Whereas in the athletics, that means who are undergoing regular physical endurance or exercises, they can even increase up to 20 to 40 liters per minute. Right? So these are very, very important definitions with in context with cardiac output that you must remember. Now, what are the physiological factors or conditions affecting cardiac output? See, there is a very common mistake. When I'm saying you factors regulating your cardiac output, that becomes your heart rate, your stroke volume, right? Those are the determinants which are controlling. So increase or decrease in the heart rate or the stroke volume will affect your cardiac output. But there is a question which says that what are the physiological factors affecting cardiac output? Physiological factors, right? So it may not always be pathological that the cardiac output is increased or decreased. There can be certain physiological conditions which would be attributed and which can affect your cardiac output. For example, increase in cardiac output very, very physiologically in exercise, even after meals, in conditions where there is increase in the sympathetic rush, anxiety, okay, then any strong emotions, excitement. Suppose there is a result, your result is there, right, and result may you've cleared and you were expecting 65%, but you got 75, so you will be excited, and that is going to increase that adrenaline rush and your cardiac output will be increased, right? Even increase environmental temperature can also increase your cardiac output. But there can be a decrease in the cardiac output in certain conditions like posture. That means standing, especially from lying posture. So there was a person who was lying down for a long time and suddenly he stands up. There will be venous pooling of the blood. That venous pooling of the blood will have a tendency to cause a decrease in the cardiac output, right? And even if there is excessive sweating. Why an excessive sweating? Just imagine you are standing in hot sun. What happens when you are in hot sun? Chakkar jaise lagta hai, isn't it? You feel like as if you will fall down. What happens is when we are standing for a prolonged time, again, if there is excessive sweating or if you are standing, when you are standing, there is venous pooling of the blood. If there is excessive sweating, the body fluid or the extracellular fluid is lost via sweat, and that is resulting in a decrease in the cardiac output, okay, because the venous return decreases. So remember, these are certain factors which can increase or decrease the cardiac output physiologically. Sleep में क्या होगा? It will neither be increased nor decreased. There will be no change in cardiac output in sleep. No change. This is very important. Okay, cardiac output is going to be same, or it will not increase or decrease as far as the sleep is concerned. Then, considering other factors, right? So these are the physiological conditions which are going to increase or decrease. How about age? So you will see that the cardiac output is less in elderly. It is less in elderly. With elderly, there is a decrease in the heart rate, there is a decrease in the stroke volume, the body muscle mass also decreases. However, if you see in children, the heart rate is more. Okay, the heart rate is more, but the stroke volume is not very high. Okay, the stroke volume is not very high, although the cardiac output is, the heart rate is high, but the stroke volume is not very high, it is less. So the ultimate effect in the cardiac output in children will be also a comparatively less cardiac output. ठीक है, a comparatively less cardiac output, although the heart rate is more, but stroke volume is not more in children. Then any conditions when there is sympathetic stimulation, as we have just seen that exercise is one of the very typical example. Exercise, very typical example where there is increase in the sympathetic activity and the exercise increases, because exercise itself will bring about lots of sympathetic factors, and sympathetic factors may you will understand that how the sympathetics they bring about increase in the cardiac output by acting directly on the heart, by acting on the circulation, which we will consider when we study the cardiovascular regulation. And posture, I told you that when you are in a supine position, the venous return is more. As soon as the person stands, there is venous pooling of the blood, and that venous pooling of the blood, or there is accumulation of the blood in the veins of the legs, okay, and the venous return decreases. Okay, so these are the physiological factors which are going to affect the cardiac output. This comes as a short note. Now, how can you measure the cardiac output? Now, measurement of cardiac output is not a must-known competency, right? It comes under desirable competency. That means if you wish to learn. But out of this, fixed principle is important, because fixed principle is asked as a short note. So we will concentrate on the fixed principle. However, I'll just let you know the names of different methods by which you can estimate cardiac output. So it can be measured directly, and it can also be measured indirectly. So you should just know the name of the methods by which you can estimate cardiac output directly or indirectly. Directly, however, this is only done in experimental animals. You don't do it in human beings, because what you are doing is you are putting an electromagnetic flow meter directly into the ascending aorta. Okay, so this is only in experimental animals where the cardiac output is measured. The cardiac output is measured by placing an electromagnetic flow meter. Placing an electromagnetic flow meter in the ascending aorta. In the ascending aorta, or you can measure it with something which is called as cardiometer. But again, directly you are placing something, so it is only with the experimental animals. There are various methods by which we can determine cardiac output by indirectly by different methods. These are the fixed principle or the fixed method. This only we are going to consider. You should remember the names of certain other methods, that is the indicator dilution method. If ever there is a BAQ, just enumerate the different methods of studying cardiac output or measuring cardiac output. Then there is thermodilution. And the most standard method or the preferred method is echocardiography. So echocardiography is nowadays practically done, right? Echocardiography is also very, very important to find out the ejection fraction, right? To find out the ejection fraction. Now let's see the fixed principle, and then we can move on to the regulation. Right? So what is the fixed principle? It is used to measure. So what is the fixed principle? The fixed principle is defined as the amount of a substance, the amount of a substance taken up by an organ. So the amount of substance that is taken up by an organ or by the whole body, or by the whole body. So amount of substance that is taken up by an organ or by whole body per unit time. Per unit time is equal to, so the amount of substance that is taken up either when we are considering an organ or we are considering the whole entire body per unit time, it is equal to the arteriovenous difference of that substance. That means the you have to measure that substance in an arterial sample and in a venous sample, and you have to take the difference times, that means multiplied by the blood flow, multiplied by the blood flow. So what does it say? The amount of substance taken up is equal to the blood flow multiplied by arteriovenous difference of that substance. Now यहाँ पर when we are when we are considering cardiac output, हमको क्या पता लगाना है? हमको पता लगाना है blood flow. So we can say that the blood flow is equal to the amount of substance that is taken up. Okay, the amount of substance that is taken up divided by arteriovenous difference of that substance. Got it? So with the fixed principle, we are just substituting it and we are obtaining the blood flow. Now what substance will be taken up? Okay, we need not give any external substance. We need not give any external substance because हमारे पास एक substance है जिसका uptake हमको पता है, that is oxygen. So what we will do is we will just measure the cardiac output by knowing the oxygen consumption, which we already know, it is 250 ml per minute. We will take a arterial sample and find out its oxygen content from any peripheral artery, and we will take a venous blood sample to find out the oxygen content in the venous blood. Usually it is taken from the pulmonary artery by placing a catheter into the through the heart. So you're going to put a catheter through your heart, reach it to the pulmonary artery to take up the venous blood sample, and from any peripheral artery you will take an arterial blood sample. So you can calculate the cardiac output is equal to oxygen consumption. Oxygen consumption, obviously it will be in ml per minute divided by arterial oxygen minus venous oxygen, right? This value. So we know that the arterial oxygen, okay, the arterial oxygen content is around 200 ml per liter, 200 ml per liter, and this is around 150 ml per liter, and oxygen consumption is 250. So 250 divided by 200 minus 150, which comes to 50, and so you're going to get as 5 liters per minute. 5 liters per minute, right? So if this comes as fixed principle, sometimes comes as a short note to you. Now, what is the advantage of this method? It is a quite accurate method. So the advantages is that it is a quite accurate method, and इसमें you are using the oxygen which is normally taken. So no chemical is being used. However, it has got certain disadvantages. How? You need to hospitalize the patient, isn't it? You require hospitalization because you have to do a catheterization. You have to put the catheter into the pulmonary artery and take a sample. That is a special technique. So there is a risk of this catheterization. There is a risk of catheterization. And sometimes what happens when you are subjecting a person to any kind of an operational or interventional procedure, you're doing a catheterization, you're putting up some, you are doing some intervention, right, or some interventional technique, this will result in anxiety, which itself may cause an increase in the cardiac output, right? So these are certain advantages and disadvantages of the methods with your cardiac output. Now let us consider the factors which are regulating cardiac output, or the factors which are affecting cardiac output. We will try to make it as simple as possible because this is a very important LAQ, and I don't want that at any point of time you should be confused. So up till now, what did we do? We considered certain normal values and definitions. We considered the methodology, and now we are going to have, after the physiological factors affecting cardiac output, how do you bring about the regulation of cardiac output? Regulation of cardiac output. Now we know that cardiac output is equal to heart rate into stroke volume. ठीक है? Heart rate into stroke volume. Heart rate is controlled mainly by the autonomic nervous system, and there are various hormones